understand it, to know when it's used, how it's used, and why it's used, and maybe give some examples as well. Okay, so kicking off, I'll tell you a little bit about myself first of all. I've been a nurse for 15 years. Used to live in the UK and I was trained in the UK. I moved over here with my family in 2012 and I moved up to the Joondalup area and I did nursing at Joondalup Hospital. So I went in there pretty much the same as the UK. I went in there and on one of my first shifts, it was a busy shift and it was on a sort of a general ward where they had surgical patients. They also had a few medical patients as well. The nurse in charge, the nurse unit manager and her second in command was giving out the duties, telling us who our patients were. And one of them said to me about my patient load and said, can you do an FBC on this patient? And gave me a whole other list of things to do. So I was happy with my wrote down all the things and the jobs and what else I needed to do after I went today and did my business. Later on, I came back. I'd done all the things that I needed to do and I was just sort of tidying up at the end of a long shift. And the nurse in charge said to me, have you got the information, the FBC for me? And I said, no. I said, I've sent it off. I'm waiting for the results to come back. And she looked at me very puzzled and not very happy and said, what do you mean, what results? For the fluid balance chart. My face must have dropped. In the UK, FBC is full blood count. So what I'd done, I'd gone along to the person involved with a needle, with some tubes, filled in the form, went ahead, did some bloods. They were okay with it, but it wasn't what I needed to do. And I didn't have anything at all to do with fluid balance chart. So at the end of the shift, I had no idea how much that person had peed, didn't test it, didn't send any off for analysis. He said I'd taken their blood and I didn't need to. So the long shot was that the nurse in charge was not happy with me at all and very quickly reminded me that I'm now nursing in another country. And every country, some things are the same, but there's a lot of differences, and don't ever make an assumption. I never went back to that unit, that was my choice. I don't know that she would have had me back there, she wasn't very forgiving. And it was a big lesson to learn, because when you work in a hospital, you'll find that there are some people who understand and who will explain, and there are other people who just expect you to understand. And as a member of staff, what I kind of had neglected, I just was so used to going in and running the show, I'd forgotten that I'm in another country, it may be different, maybe it would be advisable to sit down and just check with someone. Go through everything that I was asked to do and make sure that I was going in the right direction. I wasn't just going on a complete whim and doing something that I shouldn't have done. So just a lesson. So it's great to hop in and think you know what you're doing, and it's all for the greater good, but sometimes it can come back and bite you. All right. So today we're talking about medical terminology, and you'll have to excuse me if I. Right. So first of all, the definition of medical terminology. It's a language used to precisely describe the human body, including its components, the processes, the conditions affecting it, and procedures performed upon it. As soon as you hit a hospital or a healthcare setting, you'll notice that it's like a secondary language. I've been doing it for years now, and I still get confused. There'll be people coming in from all over. I work in mental health. There are doctors and staff that come in from ED especially and other multidisciplinary areas, and they'll have a whole sentence at me, and I'll just look bewildered. And then I'll have to sit down for the next 10 minutes and Google and just think, oh, what did they mean? Because it's so confusing, and there are so many words that sound similar to other words, especially medications. Do any of you work in a hospital now? No, any of you going to? I haven't put you off, have I? No, it's good fun, but it is a lot harder than I think we think it is. So, when is medical terminology used? Within healthcare and the hospitals. Schools and universities use it a lot, especially when you're studying biology, human biology, or health. Pharmacies use it an awful lot. You see the ladies at the counter throwing around different words, and obviously you've got your chemicals and your tablets. Books, TV shows, and the internet. So we all watch Grey's Anatomy and 911. Do any of you, or is it just me? No? Anyway, all medical terminology, and it's only when you're in the profession that you listen and you pick up words and you think, oh, that's not quite right. But actually sometimes it's because I'm sure they get advisors. But what it's done is it's led the public to think of things and listen and think they know something when it isn't really, and everyone just gets very confused following that. So, when is it used? It's used for surgical and medical procedures, in describing an operation, to describe medical conditions, and to describe a medical behaviour or the level of symptoms. Basically, it's used everywhere. So when it is not appropriate to use medical terminology when you're in a hospital setting, can anyone think? I've written it down. When you're talking to a patient, and why? Because they don't understand and they don't get confused. How many of you have been a patient and your doctor has said something to you and he's used lots of terms that you don't understand and you're too scared to ask him what he was talking about? And how did you feel?
Confused. And then, like, I don't know how to start to question the doctor as well, because the doctor keeps saying all the things.
That's right.
Yeah.
They've got there's a very senior, sort of, not an attitude, I suppose it's an attitude, but what happens is when you do something for so long, you forget where you came from. You forget where you started. And so doctors, all well-being, when you go to them for help, what you actually want is for them to help you and for them to tell you in a normal frame, a normal term, that you'll understand what's wrong, what's going on, how they're going to help you. But what happens 90% of the time, especially when you're going to hospital and you have your consent form signed for an operation, a doctor or a team member will come out and will use lots of words with more than 3 or 4 syllables, and you'll be left sitting there not knowing what's going on and just guessing. And the other thing that goes with that when you're in a hospital setting is it's time. It's time management with all of them. They don't have the time to sit there and talk to you and explain to you in a way that you will understand. Sometimes it's because they've forgotten because it was so long ago. Other times it's literally because they think that you already know what you're there for. And so outside of this, what I would say is when you go into a hospital, please stop them in their tracks. Make sure that you are 100% sure what you are being told and that you understand the terms that they're talking about, because it can be very, very confusing. Hopefully nothing serious like they amputate a wrong leg or something like that, or you think you're going in there to have one thing removed and something else is gone instead. But it is very confusing and it's very upsetting and it causes a lot of issues. So this is what people do when they don't understand. Did you like that? They look up on Google and they get more confused. They self-diagnose, and I do that too. They make themselves more agitated and more worried. They panic and they discharge themselves and they don't get the treatment that they need. We've all seen people go to ED because they're not well. I've dealt with ladies who go to ED and this was back in the UK, and they're bleeding profusely. And someone says something medical terminology, gets them scared. It could even be the word needle. Normally it's needle plus needles. And straight away they're like, oh no, I'm fine, I'll go home. I'll be fine tomorrow. So you really have to watch how you speak to anyone. They underplay their issue and take the wrong medication. That's another very common one. They don't really understand and they don't think it could be as bad as it is, or they're just overwhelmed by the whole process. And they feel very isolated and frustrated and they don't communicate. And that's a huge one, because I still have the white coat complex to a certain degree. Do you know what white coat complex is? Okay, some people, you know, don't you, Vicky? As soon as you see someone that has a white coat on, normally a doctor, you just feel sick. I'm like that with police as well, even though I'm not guilty. But people have that effect on you when you often go into hospitals. As soon as they're approached by someone who is of authoritarian figure, like a doctor, they can't talk, they go quiet. There's an assumption that they know exactly what's wrong with you, and a lot of the time they do, but you need to know yourself. When you're not feeling well, you've got a gut instinct what it might be, and a lot of people don't verbalize that. So they'll go through a whole load of tests and things that they might not necessarily need. If you feel that you don't feel well and you've got an inkling what it might be, don't be railroaded, especially by medical terminology, because they will. They're strong people and they do know their stuff, but they can get you very confused, very overwhelmed, and it's not pleasant at all. Right, commonly, oh my Y's gone down, commonly used medical terminology. So these are just common ones that we use every day. To be sick, or to spew. In a hospital you won't ever hear that. You will from the patients, but the staff will always say to vomit, or emetic. Have you heard of antiemetics?
No.
Antiemetics are commonly used in hospitals, and they're to stop you feeling nauseous. If you were to go on a boat to Rottnest and you had bad travel sickness, you would want an antiemetic. To have a nosebleed, epistaxis. When I first heard that, I thought, what are they talking about? And it's a nosebleed, it's the word that they use. You don't ever hear medical people say nosebleed. Can't control your bladder, so that's incontinent of urine. You won't hear the word wee in a hospital, very rarely. You'll hear urine all the time. And can't control your bowels, incontinent of feces. So that's important when you're working in a hospital. If someone, for whatever reason you're there, if you're a PCA or you're an AIN, an assistant nurse, if you're told by anyone that there's a patient of yours who is incontinent, please put gloves on, please put your precautions on, because incontinent of urine or feces means that it's not going to be clean. There's going to be a issue, and so you definitely will need gloves and an apron. All right. Right, to break a bone, fracture. Hemoglobin, that's another common one. Now that's blood. And the path lab, that's the pathology, the laboratory for blood samples. People will throw that word around all the time, and you'll wonder what they're talking about. Is there a person there, a body there, or parts of a body? And ordinarily in a hospital, they're talking about where you go to get your blood results, or where you have to go to get your blood taken. So we've got a stomach ache. It's actually not the stomach. The stomach's another area. It's the intestines. It's about 4 miles of squiggliness in your tummy, and it's anything that's to do with your stomach is gastro. Okay. And then there's eyesight, optical. All these words you'll hear commonly within a hospital setting or healthcare setting, or you'll hear parts of these words, and the second part will give you more of a clue as to what's going on. Medical terminology is often 2 words made into one. So as long as you know what the hema bit, the hemoglobin, that's blood. If you hear hematology, it's a blood test or blood department. Right, now levels of illness or diagnosis. He doesn't look comfortable, does he, at all? Now, there's acute and there's chronic. Acute, any illness that develops quickly, it's intense, or it's severe, and it lasts relatively a short period of time. Can anyone suggest anything?
Gallbladder.
Yeah, oh, that's really painful.
Funny.
And the operation afterwards is
Yes.
even worse, isn't it?
Yes,
There's a-
sure is.
You'll know if you have it. And there is a phrase, I'll have to say this now, it's, I don't know whether they use it over here, it was fat, 40, female and fertile. If you have all of those things, that's the majority of people that get gallstones. It's the female style, it's the female gender, and it's people, so always remain skinny if you can, so fat, female, for 50 and fertile. So very common. Gallbladder is up here. Gallbladder is next to the pancreas, which is another part. Pancreatitis and gallbladder can actually feel very similar. but if you ever, it's right below your bra strap, right below your bra, and it will hurt, and it will feel like someone is stabbing you. It won't be an ache, it will be an awful pain which will take your breath away, and you'll be exhausted when it finishes. Chronic. So chronic is a chronic condition, it's a condition or disease that is persistent or otherwise long-lasting in its effects. The term chronic is often applied when the course of the disease or illness lasts for more than 3 months.
Diabetes?
What's that?
Diabetes?
Yes.
Diabetes, cholesterol?
Yeah. Someone that might have any heart condition, COPD, I would say, arthritis. Yeah. And these people will be on a heap load of pain medication, and the pain is never going to go. So if you meet anyone that has chronic pain, it's very sad that their pain is treatable, the symptoms are treatable, but it's not treatable as far as you cannot get rid of that chronic pain. Pain is the biggest issue in any hospital, and you have to get onto people's pain as soon as you can. I know I used to think to myself, well, surely if you disguise the pain, how can you then treat the person? But you have to get rid of that pain in order for you to actually speak to the person, start doing your investigating, and also to see if the pain medication you're giving that patient works. Because if it doesn't work, then that would give an indication that it's a lot more serious, or it's something completely different than what you thought. So what makes up medical terminology? So you've got 2 parts to your words. You've got a suffix, which is the part at the end of the word, and you've got a prefix. So a suffix is a letter or a group of letters attached to the end of a word to form a new word or to change the meaning of that word. A prefix is a word or letter before another, or an introduction to the word. So can anyone throw some words at me and we'll see whether, any ideas? No? That's okay. Right, so these are all suffixes. Ologies, biology. Ectomy, that's a Greek meaning, act of cutting out. Something I didn't realise until I looked about the meaning. And that means to remove. Itis, that's inflammation. When you have cystitis, so that's a bladder, a urine infection. Appendicitis, that's another example. And otomy, so that's cutting into. Once you learn the ends of these words, when you put the beginning part into these words, they'll make a lot more sense, and you'll actually be able to guess a lot of things, and it will open up a whole world that you hadn't thought of before. And ostomy, so that's an artificial opening in an organ of the body. So have you ever heard of an ileostomy or tracheostomy? Well, they call it tracheotomy at home. An ileostomy, okay. Who knows anything about your bowels? Don't be shy. Well, what do you know about your bowels?
My husband, a couple years ago, he eat nurse too much, and then he cannot go toilet, and he hurt it too much. He cannot sit down, everything, and he cannot go toilet, everything. And then go in there, and infection of the bowel, because the one of the bowel, they have a hole.
Perfect. So the bowel is a huge organ. If you ever get to watch surgery on YouTube, please do, because you'll touch the bowel and it will expand. It doesn't like to be touched. Then they have to push it back in the body as the swelling goes down. What an ostomy is sometimes people they may have cancer, they may have a part of their bowel which is dying, okay? So what they do is, so that it needs to bypass, it won't be able to travel all the way down. When you eat, I'll just skirt through this, but when you eat, basically and very quickly, your food will digest. It will become very liquidy in the first part of your bowel, lots of wiggly kind of worm looking like intestine, and then it will go into a bigger bowel, a large bowel, which will go up and down, and then it will come out. And that's where the liquid is sucked out and it becomes harder. So you'll have people that have issues with the first part of their bowel, the small intestine, and people that have issues with the large intestine, the bigger part. And they will have what we call an ileostomy bag or a stoma bag. I don't know whether you've ever seen them. Have you seen pictures of people? Yeah. What happens is part of their bowel is brought out to the surface, and you can touch it, it doesn't hurt, and it's got an opening. And what happens is every time they eat and their food is digested, it won't go down the rest of the bowel, it will stop at that point and come out into the bag. I know. They are waterproof. You get trendy coverings for them now with all different sort of pictures and things, don't you? People that go on aircraft like it because they don't have to queue up for the toilet on a long haul flight, so that's great. The downside is that sometimes a lot of gas builds up in it and it can smell a little bit, but they have powders and things for it. So if you ever meet anyone that's got a stoma bag or an ileostomy bag, that's how it all occurs. Most of the time they can be closed up again, and once their bowel is sorted out, they can just poo and what have you like everyone else. But sometimes it's a permanent fixture. There is no age limit to people that have to have stoma bags. Sometimes you'll have young children that have them, and they just adapt as they go on. People can swim with them, they can wear ordinary clothes. I mean, some people don't like to wear bikinis, but or swimming trunks, but they will. There's nothing that you can't do, but what you do have to do is be very mindful about when you change them, be mindful of how the skin is, the irritation that there might be, and just keep a check on it. But people have a very full life, even if they have these bags, which are amazing, because without them, they most certainly wouldn't be around today. So that's an ostomy, and then you've got pathy. So you are like there, I'm thinking of words now. We have to think of a word for me which ends in myopathy. So that's heart pain. So pathy is a feeling of or suffering, a disease or the treatment for a disease. Okay, so homeopathy, that's a treatment. Okay, so anything that ends in pathy, you can remember that title and think, okay, well I know what that part means. And then last of all, a scopy. And that means to observe, to look at, using a scope to view an area, like a telescope. But in the medical field, what you will use, if you have ever had an endoscopy or a colonoscopy, they're little procedures, but they do them for big procedures as well. What will happen is you will have a little insertion in your tummy, and you will have a tube put into your tummy with a camera. And they will be able to see, the surgical team will be able to have a good look around, take photos. Where I used to work, they would do videos and give the ladies the videos afterwards so that they could see what their insides were like. Not everyone's up for that, but that's how they look. Sometimes they'll find things that they weren't expecting. Sometimes that they'll find things which is good, and it means that they don't need to go any further. There isn't another need for the operation, but scopies are great. Endoscopies, if you ever hear from those, they do these are day procedure things that they do in all hospitals. They put the tube, they put the person local anaesthetic, or a very light sedation I should say, and that goes sometimes, not normally up their nose, it goes into their throat, down into a certain part of their stomach area, and the colonoscopy, it goes up the other end. So you're hitting the person from both ends. Not everyone has both. You certainly wouldn't have them at the same time, because you would be a bit sore afterwards. But just think of telescope. Anything that ends in OP or OP is to look at and to view. Okay. So we've got examples here. Biology, psychology. If any of you don't know what these words are, shout please. Physiology, hematology, that's the study of blood. Pharmacology, study of medicine. Here are some ectomies for you. So this is the removal of, so a discectomy. Does anyone know what a discectomy is? Clues in the question? Clues in the word, I should say. Okay, a discectomy is a disc in your vertebrae, which is your spine. Your spine's made up of vertebrae, which are the bones, and then between them you have the discs. So when people say they have a slip disc, they have a prolapse disc. It moves, it pushes on a nerve. But the discs are quite a jelly membrane fibre. A discectomy is the removal of that, or the shaving of that, so that people don't have the back condition that they had, which is known as sciatica. A myomectomy.
Is down here for women. Is it for women mainly?
Yes, that's
Yeah.
right.
I just recently had that myself.
Oh, did you?
Mm.
Yeah, and how was that?
Yeah. Not too bad. It's
Yeah.
alright.
So it's a myomectomy is a word that is nothing to do with the actual issue. It's when people have fibroids. So gentlemen, you'll be fine. It's not something that you'll have, but females, in your uterus, sometimes you can have a fibroid, which is like a part of the muscle grows and it becomes, it has a blood flow. So especially during pregnancy, it can grow and it can grow and it can take up the space that the baby needs to be in. So you can have there are lots of solutions. You don't have to have a removal of the fibroid. There are medicines that you can have and injections you can have, but ultimately a myomectomy is what they will do, and they will incise, remove the part of the muscle, and you'll go away and you'll be fine. Appendicectomy. Has anyone had one of those? Oh, that's good. Normally I know about 4 people or whatever that have them. It's so common because of what we eat nowadays. They still don't know why we all have an appendix. I don't know why we have an appendix, but it's kind of it's a very thin little long thing. They can do the operation laparoscopically now, where they just literally make a tiny little hole and they pull the appendix out. But an appendicectomy. A nephrectomy. Anyone heard of that? Okay. A nephrectomy is when, I will give these out actually, a nephrectomy is the removal of a kidney. So you've got 2 kidneys on each side, okay? And sometimes they need to be removed. You can survive on 1 kidney, and people get kidney transplants as well. So what I've done is I've got all these. As there's not many of you, I'll give you 2 each. And I'll explain what these are. I'm just reading all these words here, thinking this might actually help you all. Right. 2 for you, 1 for the next session, 1 for this session. 2 for you. And what these are is, when I first began as a nurse, I came across so many words like this. And I'd go home and I couldn't remember what he taught me. And it was a nightmare, and then I was trying to look things up and didn't have the internet then. And I couldn't remember how to spell things. So it became a bit of a nightmare. So now I write things down, and you've got you too, have you? So every time I come across a new phrase or a new term, I write it down, because I'll tell you, whatever direction your careers take you in the health field, you will hear these words, and you'll hear lots more. So rather than stand there and not be able to join in the conversation, at least you'll know what they're talking about. And when you watch ER and 911 on the telly and Home Away, you'll know what they're talking about as well. Has everyone got one? Right. Okay, so after that we've got a tonsillectomy. Everyone knows what a tonsillectomy is, don't they?
Removal of the tonsil.
That's right, yeah. Now I don't know what they do after, I don't know how they do now, after someone's had a tonsillectomy. A lot of they have to be very inflamed before they're removed, and it's an operation that is very dangerous the older you get because of the likelihood of bleeding. But they always used to make people have cornflakes and dry toast.
Not here, they had ice cream.
Ice cream.
Oh really? They're really cool in the
My
UK,
son
aren't they?
had 2 years ago have a cut the tonsil, very good. And after that, just have our it's eye cream and
Yeah, Australia, ice cream.
Because people would dread it. They would absolutely hate it, having to eat this toast.
Yeah.
And it was,
hard things.
yeah, it was awful. And last of all is an oophorectomy. Again, for the ladies, an oophorectomy is the removal of the ovaries.
Oh.
So, oof is for egg. And oophorectomy is the removal of. So it's the home. So these are all of these are some words, not all of, some words which are when you have inflammation. So we have labyrinthitis. And if I remember rightly, labyrinthitis it's there, isn't it? I'm sure I had labyrinthitis, to do with the ears, between the ears and the throat. People often think that they have another itis, I can't think what the word is now, but you'll have to look it up there, or that could be some homework for you. Labyrinthitis, it's up here though, and it's like swelling, and when you can't, you get a fever with it, you can't swallow. I think it's to do with the larynx and the inner ear. So appendicitis. So appendicitis is inflammation of the appendix. Cystitis is very common for everyone, and especially if you go into the health field, please drink. We are notoriously people who are always busy and don't have time to go to the loo. So I think we're the highest percentage of employees in the world that have cystitis or urine infection at some point or another, because we don't drink, because we don't have time to go to the loo. And that in itself will lead to bigger issues later on, like kidney inflammation. And then you've got pancreatitis. So pancreatitis is inflammation of the pancreas. So anything in itis, if you hear, it's always inflammation. And again, it's a very common word that you'll hear a lot. Now you get your, your removals of a laparotomy. Actually, it's an incision. A laparotomy is an incision. It's a big, deep incision, and it's in your stomach area, okay? And it goes from left to right. I do believe how they used to do it in some countries is up to top to bottom, but we ordinarily do it left to right. I've mixed some of these up actually, and the rest of them are ectomies. A laminectomy. So you probably won't remember all these words, but you will hear them. A laminectomy is the lamina, which is part of the vertebrae in your spine. And when people have back issues and they have sciatica, 9 times out of 10 the doctors will remove some disc, which is the membrane, the soft part, and they'll also remove some of the bony part, which is the lamina. So a laminectomy, and they do it at Sir Charles Gardner. They're the top people for